The BS in chemistry from Fisk University, historically Black College University, yes. And also, she went to Charles Drew Medical Center. She recently received a very prestigious award from the National Medical Association, and she was awarded the prestigious Meritus Service Award, and she's also the president of Golden State Medical Association and the California branch of the National Medical Association. Welcome, Dr. Lang.
Thank you very much, Dr. Clarice.
In today's world, one of the things that I have wanted to talk to you about today is pretty much the pandemic and how it has affected African Americans disproportionately and indigenous people, and exactly how that plays a part in your practice, emotionally, physically, and mentally. What does it all mean to you as a physician in the community of treating these types of patients?
Well, thank you for asking that question, because the pandemic is something that is having a huge impact on all of us, and particularly those of us in the African American and peoples of colors communities. For me, I'm a board-certified family medicine physician, and so I treat full scope from prenatal care in the womb, delivery of babies, well woman's care, well child care, well man care, internal medicine issues. So I'm seeing the full spectrum, and unfortunately, though when this disease arrived, they told us originally that this was something that was only impacting elderly people, what I have seen is that it is also impacting young people. And it can do that directly or indirectly. I'll just give you an example of an indirect way that it impacts young people. And I would say that is that we have such fear existing in our society and throughout our country, where we've had the worst impact of the disease, because of the fact that it's been uncontrolled. And this disease, unlike most diseases that people get, most infections of this type, has a very high death rate, as well as other morbidities that go with it. So as an example of how something that's impacting the elderly impacts the youth, I had a patient come in, a 12-year-old boy that I had delivered 12 years ago. I've been following him throughout his life. His mother came in during COVID. She brought him in one evening at the close of business and said, "Hey, I've got a problem. My child is sick. He's got the following symptoms." I examined him and I told her, "I believe your child has appendicitis. We need to get him into the hospital so that we can evaluate him fully and determine if surgery is appropriate." Well, the mother's response was, "Oh no, I can't take my child to the hospital because COVID is there. And if I take my baby to the hospital, he may get COVID and die. So I'm not going to take him to the hospital for a stomach ache." We discussed it. I went through with her all of the different potentials, what the risks are of the condition that I felt very strongly that he had. I explained to her all of the things that she should do and what she should look for. She left my office about 5:30 p.m. About 9 o'clock that night, she went to the emergency room, and the child was operated on. He did have an appendicitis. Unfortunately, it had burst, which is the natural nature and course of the disease. It's very risky. It's once it bursts like that. So for this child, and when I spoke to the mother, when I came to the hospital and saw the mother, and I said, "Well, what happened?" And she said, "All the symptoms you told me to watch for, he started developing them, and by about 8:30, he had them all, And my husband was saying, no, we can't take him to the hospital because he may catch COVID and die. And she said she and her husband fought, and she said, I'm taking my baby to the hospital because Dr. Lang has been taking care of the family all this time. She says that what he's got might kill him. I'm taking him to the hospital. And so after they fought, she took the child. The husband stayed at home with the other children and got to the hospital and found out that, yes, in fact, he did have appendicitis. It had ruptured. Surgery was successful. The child is doing very well now. But that's just an example of how, even if this only impacts elderly people, the rest of the community is in a state of fear over what is doing. I've had patients who have asthma who have called up at 11 o'clock at night. What should I do? My medication isn't working. I've done everything you've told me to do. I've used my breathing machine. I'm still wheezing. I can't get any air. And I tell them, well, you know, the routine thing is when this happens, you know what we do is you need to go to the emergency room. The office isn't open now, so I need you to go to the emergency room so you can get appropriate treatment and get it handled. Oh, but I can't go to the emergency room because I may get COVID. And I'm at high risk because I've got lung disease, so I definitely can't go into the hospital. And then I have to explain to the patient the reality that asthma kills Black people. And it kills all people, but it kills Black people in this country at a far greater rate than it kills non-Black people. So therefore, if we're having a problem with our asthma being uncontrolled, and we're afraid to go into the emergency department where we need to go in a crisis when nothing else has worked, then if we're afraid to go in there, we increase the risk of us becoming another statistic of another Black person dying from asthma. And so being able to explain all of that, break it down, help someone to understand that if you can't breathe, you can stop living right away, as opposed to if you get COVID, that's another situation. But clearly it has impacted our communities at much greater rates than it has impacted other communities, whereas our population is approximately 13% of the country. In most places, we're running at a minimum 26% of the people infected with the disease. And in terms of the death rates, we are sometimes as much as 4 and 5 times higher death rates than what our numbers are in the general population.
So, if I hear you correctly, you feel that even though it's obvious that COVID-19 is a novel virus and there is no etiology really of how and who it attacks, the fear factor in our community only exacerbates or heightens the novel virus in our community, because we don't want to go to the doctor, and we don't want to go to the hospital now because of COVID-19, because we have a fear that we're going to die if we go to the hospital or we'll get COVID-19. But do you think that that's part of some, you know, how many times through your life, my life, have we heard people feel that, people that look like us, African Americans, that, well, they were fine until they went to the hospital and then they died. So somewhere along the line, people think hospitals, surgery equal death anyway, and don't see early detection or preventive care is part of our issues. So now you add something like COVID-19, and it only snowballs into something, because you obviously have a mother who loves her child but does not want to take her child to the hospital and is actually in a full-blown fight with the father. So what would have been the solution if the mother had not done that? The child would have passed away, or what would have happened?
The risk of the child passing away are very high, because if you have appendicitis, which is basically an inflammation of the appendix, which is a part of your intestines, once it bursts, it's basically a collection of pus and infection that's inside of your body is contained, quote unquote, in that little appendagel that's there. But once it gets infected and it starts swelling and getting more infected, when it ruptures or bursts, what you have is all of the bacteria and pus that's in there being released into the body, being released into the peritoneum, and allowing that entire pelvic and abdominal cavity and all the space that's in there to be now, instead of it being a sterile space where it has been up to that point, once that ruptures, that space is no longer sterile. It's now it's no longer free of any kind of infection or disease, is what I mean by sterile. It is now filled with bacteria, and the body is not really set up to fight bacteria in that area. The body's immune system does not have the response time to get in there, and so you do have a very high risk of people dying when they have a ruptured appendix if it does not get cared for. It causes the body to become septic, or meaning to have bacteria flowing all through the bloodstream, and without antibiotics given IV to treat it, it's a problem.
Okay, we'll be right back after this brief message. Thank you, Doctor.
You're welcome.
The Real Urban Radio Network is streaming live on the World Wide Web.
Yeah, when you hear the music, Dr. Khadijah, when you hear the music, if you'll wrap up your thought,
Okay.
it'll be going into a break. It's automated.
Okay.
Okay.
And no camera I need to look into, right?
No, well, Clarice is Facebook living right there, so
Yes.
say hello to your Facebook friends.
Hi,
Clarice.
everybody. Thanks for
Hi.
tuning in. We're
So
here.
So should I be turning my
It's
chair
the
this
It
way?
would be.
The
It would be
Real
better, Dr.
Urban
Khadijah.
Radio Network with Dr. Khadijah
Shall I
It
turn
would
my
be,
chair
it would be
this
better
way?
if you were like straight on, more straight on. Thank you. We kind of rushed in.
Lord, I hope my...
Thank you. That's so much better. Thank you. And into that mic
Is
gonna
that
be
good?
great. Yes, ma'am.
You
Close-
know, that
I'm
thing
sorry.
has 3
If you can
different
get
settings
closer to
over
it,
there.
if you can get closer to the mic, then you'll be.
You can hear me because I'm loud.
Yes, that's it on low now. The other two settings are pretty loud.
You can hear me too?
Yes, I can. Yes,
Okay.
But even being closer up in it, it will be fine.
So the air conditioner thing is too loud?
I have it on low.
You have it on low?
I have it on low right now.
And it was that loud?
Right now, it is.
It's on now?
Yes.
You gotta put some water in there.
I did.
Some water in
I
my
did.
thing.
I did.
Oh, you put some water
Yes, ma'am.
in that part?
Yes, ma'am. I got you.
Okay.
Yes, I feel
Can
it
you
too.
feel it?
I do. I do. I should share it with you. Try to get it over there.
Well, I got 2 in there. I got another one.
Oh, wow. Okay, here we go, Clarice.
Welcome back to the Pain of Change with Dr. Khadijah Lang. And I forgot to say something very important. Dr. Khadijah Lang is also a member of Alpha Kappa Alpha Sorority Incorporated. And a sorority sister of mine, and we're in the same chapter, Alpha Gamma Omega, AGO, in Los Angeles, California. So, welcome back to the Pain of Change, and talking about the pandemic and how it affects African American people disproportionately, not only health-wise, but also mentally and emotionally. And we just heard a little bit about that in terms of fear, which is totally an emotion, and also how that must affect people mentally. A couple gets into a fight that really is about resolving, saving their child's life. But because of the fear of COVID-19, they didn't want to take the child, the 12-year-old, to the hospital. And when the mother did, the child's appendix did rupture. Now, Dr. Khadijah, do you feel that there's a lot of people that look like us that may have COVID-19 and know it and not seek treatment and just try to ride it out?
Yes, definitely. in all fairness, I think it's important for us to remember you've got to know your history to know where you're going. In America, the medical health care system, quote unquote, was established with a lot of experimentation, generally cruel, things that would not be legally permitted if they tried to do it today. But a lot of the learning of medicine was done by experimenting and operating on people of African descent, often people who had been enslaved in this country. No anesthesia was used, and it was simply, you know, a group of Caucasian men with an African body in front of them that they did whatever they felt they needed to do in order for them to increase their knowledge
This is
and their
Pain and
science
Change
basis.
with Dr. Clarice. You have a question for Dr. Lang? Okay, thank you so much. All right, thank you so much for calling in. Thank you.
Okay, is this better now?
Is this, wait before you go, Dr. Lang?
Can you hear me better now?
I think she hung up.
Okay. Okay, so back to what I was saying, we have a history here in America that we've got to be realistic about. That history has included experimentation, often cruel and unethical experimentation using African Americans' bodies for the purpose of learning. We have the history of the syphilis study done in Tuskegee, where hundreds of men were allowed to continue with syphilis untreated in a study, even years after a treatment was discovered, and their families were often infected, wives and children that were born from their infected wives. That's a real history. We've got the knowledge that many African American women and Latina women were sterilized, and even some African men were sterilized in this country without their knowledge. Therefore, their ability to reproduce was taken from them. So we've got a history that we've got to reckon with. And once that type of history is established, there is reason, valid reason, for a person that's thinking to have distrust of the system. This is why I believe it's so important for us to get more African Americans into medicine, into healthcare, so that we can be a part of the constructive improvement and start getting better care to people of our communities. Having said that, yes, there are many people who during the times of COVID are saying, no, I'm not going to go to a healthcare system that I do not trust to take care of me if I'm sick. To a certain extent, that is justified, because when this virus started spreading through our communities, we here in America did not have an established and documented cure, quote unquote, or even recommendation, policies, and procedures on what is a valid treatment regimen to apply to people with COVID. We are still struggling with not having definitive treatment plans for patients with COVID. So, and I would take that one step further and say the medical community, because they did recognize that they really did not have a method of treating this condition, were saying, if you're not super sick, don't come into us, because there's not really anything we can do for you. So don't come in here and overload the system if you're one of the people who were lucky enough to be fairly healthy with your infection. We need all of our resources for the ones who are super sick with the infection. So there's a lot of reasons that have contributed to African Americans not going in, and you have to add into that the fact that you've got social determinants of health playing in there, such as a much higher rate of African Americans are uninsured, a much higher rate of Latinos are uninsured. So if we do not have health insurance, then we're going to be thinking 3 and 4 times before we go walking into a healthcare system that is one of the most expensive in the world, and we have no way to pay for it, and are not trying to create a debt that we cannot do something about. So yes, a lot of people have done that. One of the things that the fire department reported in New York when the epidemic was at its peak there was that they were going in and doing an extraordinary amount of arriving and finding the patient already dead, because people were staying at home and trying to treat themselves and trying to stay away from anything that might get worse in hospitals, and waiting until they really could take their final breath to say, oh, maybe I better, this isn't working, whatever I've done, maybe I better call for some help, maybe we should call 911. But people can be pretty stoic, and especially our people. And so by the time we actually find our way in to the healthcare system, oftentimes, as with other healthcare conditions, we're arriving when it's sort of too late to make a difference, and we're arriving when things have already run their full course. And this is a problem that is endemic in our community for multiple conditions, because with your question about people saying, well, when you go to the hospital and you have surgery, you die, as an example, many people will have cancer of any type, and they'll start feeling symptoms, they'll be feeling poorly, they'll try everything they can to handle themselves, but in the meantime, the cancer is not being treated, it's not being truly addressed. Whether that means that you stay at home and don't do anything, or whether it means you stay at home and you try to start eating healthy and you go on a macro diet, whether it means that you're taking herbs and things like that. One of the big problems I see in our community is when we decide we're going to use alternative medical treatments, we often do not get appropriate instruction on how to use them. And I tell my patients, if you want to use an alternative method, that's fine, but make sure you're using it correctly for that type of method. Don't say, I bought this tea from the herb shop down the street and they said this is good for this condition, so I'll have a glass of it every other day because it's pretty expensive. But if the recommendation from an actual herbalist who's familiar with the proper use of that herb is you need to drink this tea 3 times a day, and you're drinking it every other day because it's expensive and not covered by your insurance, you're doing yourself harm, because this is still a medication. It needs to be taken in the way it is prescribed by the person in that healthcare system. If you're going to do an alternative health method, make sure you're doing it under the auspices and the guidance of a knowledgeable person who has trained in that field. Not just someone told me this was good, I'll try it, and you try it whichever way you can imagine. Get that same type of information that you would hopefully get if someone gave you a prescription bottle of medicine. You would ask the pharmacist or your doctor, how am I supposed to take this? When am I taking it? Do I take it with food or without food? How often do you need me to take it? How many days do I have to stay on this? These same types of questions need to be put to alternative methods of treatment if we are going to do them. And we need to have diagnoses in order to determine what should we be getting treatment for. So it's also important that we do get preventive healthcare checkups so that we can learn early, at the earlier stages, if there is something going on. So I say all of that to say, yes, there are very real reasons why oftentimes African Americans are late in presenting to healthcare systems, and that late presentation can contribute to poorer outcomes for us, regardless of the reason that it was a late presentation.
Dr. Khadijah, after we come back after this break, I want to ask you some questions again about trust, healthcare insurance, and exactly what are some of the approaches that you feel that our audience should take in terms of overcoming the lack of trust, in terms of looking at their health as paramount to survival and not trusting, because what else do we have? I mean, there's no cure for cancer, but early detection is certainly truly has been proven to work. And you know, when I didn't want to bring politics in this, but when we come back, I want to talk to you a little bit about your thoughts about the President of the United States, who admitted that not only did he know about the disease in February, that he intentionally played it down and then adds, and he continues to play it down. So on that, we're going to take a break. And we're going to come back with some more with Dr. Lang and the pain of change. And what's your pain of change? I want you guys to think about that for the next time. What's your pain of change? So right now we're going to take a break, and we're going to look at some of the things that we could think about in terms of the pain of change now.
Okay, so don't worry about wrapping it up until you start hearing your music. You've got 21 seconds of music, so if you start wrapping it up in your music, you'll be good,
all right, then I'll wrap it up.
Right.
Okay.
So you're giving me two different things at one time. I'm going to, which one do you want?
We're going to go back into the pandemic, the emotional and all that, but I'm going to talk, I want to ask you, you talked about trust.
Okay.
And so,
I'm sorry. No, you're good. You've got another 15 seconds after
Okay.
this.
I talked about trust.
we're going to talk about
Ask
trust.
me about politics,
Tell me
but
about
after
God,
that,
right. And
before
then
that,
after
you want
that,
me to
we'll
talk.
talk about how do we decide, how do you as a physician break down that barrier of getting people to trust and love.
So nothing about treatment. Nothing
Yeah,
about.
we can talk about treatment. We can
Well,
talk
that's why
about
I'm asking you. What do you want me to talk about in this next section?
Well, we talk about the fact that how do you get people to trust? How do you get people to go to the doctor? How do you get people to realize that the life that's
Okay, here we go, ladies. Here we go, okay? Yeah, I got this.
I hope everybody out there is enjoying the show with Dr. Khadijah Lang, here talking about the pain of change. Dr. Lang, what great information, and I hope our audience is enjoying it as much as I am and Jeanette Aguilar is. One of the things, I didn't want to bring in politics because that was not what I wanted this show to be focused on. But this week, or last week, the end of last week, our President of the United States of America made an admission, and he said, yes, he knew about the virus, he played it down, and he continues to play it down. So in line with trust, do you feel that sort of thing totally adds to the credence of why Black people don't trust the system, A, and B? What is a clinician, is a person that has given her life and her passion to people of making the Hippocratic oath saying, do no harm. How do you feel about things like that when you hear that someone intentionally decides that they're not going to even help save anyone's life? And how do you break that down, that barrier down of getting people to trust you and trust the system? And the second question is healthcare. So when people come to you uninsured, what do you do? How do you handle that?
Well, I think in response to your first question, with regards to the revelation that there has been intentional downplaying of the impact and the actual danger and significance of the morbidity and mortality of this disease, I think it adds to further confusion on the part of patients. It increases that sense of insecurity and distrust of, okay, now someone is saying to me that, yes, I did know that this was dangerous, but I didn't tell you because I thought you weren't going to, for whatever reason, I didn't tell you. And now that it's being brought out, then I'll tell you. This creates a further deepening of the distrust that we have with the healthcare system and the political system. We're in a political system where we're seeing that African American lives are often undervalued, devalued, or not valued, period. as we see so many of our people, male, female, young and old, having their lives taken wrongly, and the persons that have perpetrated this stealing of their lives pays no consequences for it, is able to continue walking the streets free while this person is now under the ground. I think that all of these things add to the feelings of distrust and the feelings of very, very great reticence to actually listen to what's being said by healthcare providers in the health community, because the reality is I was born and raised in South Los Angeles. I've gone to school in South Los Angeles. My elementary school was in Watts. I've been literally born and raised in my quote-unquote community. I even went to medical school in Watts at Charles Drew University. But despite that, once someone walks into an office and sees the white coat on me or they see the stethoscope on me, I am now a part of a system that they are untrustful of with valid reason. So the fact that I may be a black woman who was born and raised in this community does not mean people automatically feel like they can trust me, and I'm okay with that. I think that that means that they're aware of the circumstances they're being raised in. I think it's important for all of us to establish a relationship, because once you establish a relationship with a person, then you're able to start better judging, can I trust this person or not? I encourage people, go out and get a primary care provider, because once you've got a primary care provider, then you can assess that person on your own, and you can use your gut instinct to say, is this person really looking out for my interests? Are they really doing a good job for me? If you're following up, if there's any condition, if they're checking it, and you can see the condition is either getting worse or getting better, that allows you to be able to assess what is this person doing for you and for your health condition, and then hopefully have a greater confidence in them. But what I do say to patients is, if you went to the hairdresser and they gave you a bad hairstyle, or you said, dye my hair this color, and it didn't come out looking good, you wouldn't say, I'm never going back to a hairdresser again because somebody dyed my hair and that shade looked terrible on me. Or they cut it all uneven and I look like a mess now. You would not say, I will never go to a beauty shop again because the hairdresser I went to did a poor job. What you would say is, I'm not going back to that hairdresser again. And so this is what I encourage people to do, is establish a relationship with a primary care provider. And if that relationship does not work out well for you, if you're not comfortable with it, if you do not feel like, yes, I can really feel that this doctor, I can have confidence in what they're recommending and what they're saying, I do feel like they're looking out for my health, then change providers. Even if you're in a managed care plan, you have the right to say, I want a new doctor. I'm not comfortable with this doctor. We also have a right that we do not really push often enough, and that is the right to say, as a patient, you can say, I want a physician or a provider of my own community. I want someone that is fully culturally competent with me and the life and the community in which I live. We don't do that enough. Whoever we get assigned to, we accept it. We go back out and talk to friends and other people. Oh, I can't understand what my doctor is saying. I can't half understand them. Or my doctor never talks to me. They spend the whole time on the computer and they hand me a script and I'm out of there in 2 minutes. They never even touch me. They never put their hands on me. They just come in, ask me a couple of questions, stick something in the computer, hand me a prescription and tell me come back in 3 months. Well, if you accept that, then your health plan will say you're okay with that and that's good enough, and you continue getting that type of care. If you call your health plan and say, no, this doctor is not giving me the type of care I want someone that I can talk to, someone who will listen to me, then the physician, they can change you to another physician. Other people go in, Latinos go in and say, I want a doctor that can speak Spanish. That's why they're putting in such a big push now to have doctors that are bilingual with Spanish as a second language. Asians go in and demand a doctor that understands their culture and can speak their language. And they're bringing more of them in because of that. Black people don't go in and say, why are there no black doctors for me to choose from on the panel that you have? and therefore they can continue excluding black physicians from the panels, even though they've got the same qualifications as non-black physicians,
or more,
because nobody is pushing them on the issue. When women started insisting they wanted a woman to take care of them in obstetrics, all of a sudden you saw this huge push from the healthcare industry and the insurance industry to say, well, we got to get more women in here in our OB department because the women are refusing the male doctors. And there was a big push, and now you've got female OBs all over the place because the response of the patient saying, I don't want that, this is what I want, caused them to say, we're going to change our culture a bit and start pushing and bringing more in. When black people start standing up and demanding that they have more black physicians available on panels for whatever plan they're in, they will start being forced to do more about that. And studies have shown repeatedly that black patients get better healthcare results when they are taken care of by black physicians. That's a fact. It's documented in JAMA.
This is the pain of change with Dr. Clarice. Do you have a question for Dr. Lang? Hello? This is the pain of change with Dr. Clarice. Do you have a question for Dr. Lang? Okay, I guess they'll call back. Okay.
So I think that it's very important for us to know what are our rights and what is the power that we have. If black people in numbers go to their HR departments and say, the health plan you put us in, there's no doctors that look like me, there's no doctors that understand me, and that understand what I mean when I talk about certain things which are a part of my life and my culture and the way we do things in my community, then they don't have to do anything about it, and the status quo persists, and we get more physicians who may mean well, but who may not have the cultural competency to understand what your real needs are. If a doctor says to you, well, just go out and exercise and buy some fresh vegetables, and they don't realize that you're in a food desert, and they don't realize that the streets that you're on are poorly lit, or lots of cracks in them, or lots of robbers out there, then they're not going to understand to try to, let's find some additional alternative ways for you to get a healthier diet, for you to get an opportunity for more physical activity, and for you to feel safe in your own community.
This is the pain of change with Dr. Clarice. Do you have a question for Dr. Lang? Hello? Oh, please, welcome. And you are?
Dr. Ogun.
Okay, hi, welcome.
Assalamu alaikum, Dr. Ogun. Welcome to the program, and thank you for joining us. Good, good.
So do you have a question, or you just want to join the conversation? Okay, all right, thank you.
So you can download the Real Urban Radio Network app. You can download the Real Urban Radio Network app, or you can go to realurbanradio.com, okay? We'll close up the phone line, but you can listen in those two ways, or Clarice Kavanaugh's personal Facebook page, okay?
Or the Pain of Change Facebook
or the Pain of Change Facebook page. Thanks so much for calling in, okay? All right.
You know, I have a question. You said a lot of really important things. And I have a friend that's Hispanic, and it's so interesting that you said what you said about demanding. His mother is elderly and Hispanic, and she has an Asian doctor, and he demanded that his mother have a Hispanic doctor because he said to me that the doctor doesn't understand their culture, and they're working on getting her of doctors. So we're going to come back and talk about that after the break.
Radio Network is streaming live on the World Wide Web.
Sorry, Sissy. Okay, so when you come back, Dr. Clarice, this is your first show. You're doing amazing. You're doing fantastic. We're going to get gelling to each other's cues and stuff. But when you come back, this will be your last 12-minute segment.
Okay.
Okay. And then you'll have like a minute of music at the end of that 12-minute segment where you can truly wrap it up and see you next second Sunday.
Oh,
in the month. You'll have a minute of music that you can talk over.
While the music's playing, or the music?
While the music is playing, you can talk over that.
Okay.
And are we going to talk at all about vaccines?
Yeah, we can talk about vaccines. Okay. I'm going to ask you what your thoughts are about that.
Okay.
Experience on the Real Urban Radio Network. Our mission is to empower.
So I hope everybody out there is enjoying the show, The Pain of Change with Dr. Clarice and Dr. Khadijah Lang, who is giving us some amazing information and little things we should think about in terms of our health, not only with the pandemic, but a lot of different things.
Here we go.
So we're back with Dr. Khadijah, and we're on air at the Real Urban Radio Network. And Dr. Khadijah, so we've talked about a lot of things. You brought up a great point about demanding someone that looks like you in your network, or even seeking physicians that look like you if you're in a PPO.
Correct.
So we've talked about racial unjust. We've talked about being able to have access to physicians. The reason why we don't, sometimes because of trust, we don't have insurance, we take alternative medicines and we don't take them the right way because they're expensive. So let's talk about a vaccine for COVID-19 and your thoughts of a vaccine. Would you or would you not, during the first wave? Now, the first wave is the first 10 million doses they're going to give out to whoever, And from what I've read from the Center of Disease Control, those doses are going to be given to people basically over 70. That's what they say. Okay, but we know the rich and the famous will find somewhere to get it, and they can be 12, right? So, that being said, how do you feel about vaccines? And as we're closing, I want you to close out on, if you had an ability of waving a wand of what you would do to make things different and better as a physician for people that look like you and all people, what would that be as we close out? So let's do the vaccine, and you get a time to bubble in the brain to think about the other part. Because I see the brain percolating over there. Like, where would you start, right?
Yeah, you gave me several things to address, all of which are really relevant points. Let me start with the vaccine, because I know this is something that's probably of concern to a great concern to most of us, I would hope. Given that we've got a disease that is killing our people at numbers far greater than other people are dying from it, I took a Hippocratic oath to try to save lives and do the best I could. I believe that it's very important that people can come up with a vaccine, but my personal, and this is only reflecting my personal opinion, is that there should be a bigger push for treatment of the condition. We are losing over 1,000 people a day to this disease while we're racing for a vaccine. And I believe that while we're still losing people every day, we should be having at least an equal, if not greater, push to be able to treat the condition and to know how to safely and effectively manage patients with this disease from the first diagnosis throughout their course with the disease. So I think that something we should all be doing is speaking to our legislators and our elected officials to say, you guys are passing bills to make a lot of money and funding available for research to produce a vaccine. What are you doing to produce a treatment? Because first and foremost, as you just mentioned, the first set of vaccines that come out will not be available for everybody, and distribution of them is going to be problematic. So in the meantime, people are still dying of the disease, and I believe that it is imperative for us as a nation to say, what are the treatments that we can find that are effective, make them available to everybody, and make sure that the various hospitals and physicians throughout the country know what those methods are. With respect to the vaccine, I think that in making a vaccine, I know I have been a principal investigator in research studies for major pharmaceutical companies, phase 2 and phase 3, and I know that during a trial, during a clinical trial of a vaccine, a person has great protection. Great protection. I mean, yes, there is risk, but your protections are so great within those programs. You automatically have health care. When you come into a clinical trial, you are given a phone number that you can call 24/7 should you have a side effect, or should you think you have a side effect or reaction to that vaccine. You have a hospital that's already identified where they will take you, and all of the bills are covered. You don't have to worry about it, and they take good care of you because they do not want to have a bad outcome, an adverse effect of someone taking their trial medication. Yes. I say that because at this point, right now, the vaccine studies that they are doing, the phase 2 studies, the 3 studies, where they're trying to get upwards of 30,000 people to participate, they've only got about 25% Black and Latino patients participating in these studies. Now, some people might say, that's not bad. We're only 13% of the population, and Latinos are 18%, so that's not bad. Not to mention the fact that typically, if a study has 2% of Black patients, they're considered to be, we've got a standard amount.
Study, right?
Yes. So exactly. We already tend to not be involved in clinical trials, and right now, given that Black and Latino patients are making up over 60 to 65% of the people that are infected with COVID in this country, having 25% of us participating in the clinical trials is not adequate. And this is important because some drugs work differently in Blacks versus Latinos versus Native Americans versus non-Hispanic whites. All of these groups have different genetics going on, and in some cases, our genetic diversity can impact how that drug affects our bodies. We need to know that if a particular vaccine coming out has some problem in people of color, whether it's a particular problem with Blacks or with Latinos or with women or with men, we need to know that, okay, the drug doesn't work too well in this subset of the population. What do we need to do to make it safe for that population as well? But if we are not included in the clinical trials where there is full protection, I don't want to use the word full protection, but there is definitively protection and management for you with an actual interest in making sure you do well with it. Once it comes out, then all of a sudden, it's being given to you, and you're really doing an experimental trial at that point.
This is the Pain and Change with Dr. Clarice. Do you have a question for Dr. Khadijah Lang?
I agree 100%. I agree with you 100%. I believe that all of the facets of and diverse populations that make up the American people need to be represented in the studies in proportion to the rate at which they are being impacted or infected by the coronavirus. I am not trying to leave out anybody because all of us have various makeups.
This is the Pain of Change with Dr. Clarice.
You're welcome.
Thank you for calling in.
Oh, thank you so much for calling in. I hope that answered your question.
And the other reason I think this is very important is I think, as you all know, or as some of you may or may not know, we recently in this country had a controlled outbreak of measles. And it was in a very small population. But as a result of that outbreak, children all over the country are being forced to get immunized, even if it's against their political or spiritual or personal beliefs. And so in case we are forced to take immunizations once they become a vaccine, once it becomes available, that makes it all the more important for us to know whether or not it works for us.
Yes, this is the Pain of Change with Dr. Clarice. Do you have a question for Dr. Khadijah? Go ahead. Hello, niece.
Thank you.
Hello,
Thank you for
niece.
your call. Welcome. You don't have to go to the hospitals to get into a clinical trial. Again, we've got to be calling our legislators and saying, our tax dollars are funding these studies. We want you to make them, require them, the pharmaceutical companies doing the studies, to include adequate numbers of our people, because right now they're rushing to make sure they can be the first one to get a working vaccine, and therefore they're not necessarily putting as much effort in. And I shouldn't say that, because the fact that they're up at 25-26% is very good for a clinical trial, but we need to let them understand that that's not quite good enough given the numbers that it's affecting us at. So I would say, again, call your legislators and tell them to force the pharmaceutical companies that are working on tax dollars to reach out further and get more of us in.
And you can also go to cdc.gov and put in volunteer for vaccine, and there's a whole form that comes up. I will talk to you later. Thank you, Nisi, for calling. Love you. Bye. So, Dr. Khadijah, as we close, you get a wish list of what you could tell someone in closing. Thank you for being here. The information was much more than I could have ever hoped for, and thank you for your expertise. But what would you leave us with? Is what you would want to tell people?
I would leave us with telling people, number one, we need to push our legislators, whatever party you're affiliated with, for universal care so that everybody has health care, and that is one barrier we don't have to worry about. We need to make sure that everyone has access to clean water so people can wash their hands frequently. We need to make sure that regardless of what some others do, we should all be wearing our masks so that when we are coming in contact, we don't know. Everyone does not show symptoms when they're infected, but they can still be infectious. We should be wearing masks when we are not with our household population. And most importantly, if you have a health condition, diabetes, hypertension, high cholesterol, make sure you are keeping that well controlled so that should you become infected, those conditions are already in the best state of control so that your body can have more energy to fight the infection should you become infected.
Thank you so much, Dr. Khadijah. And that wraps
social
up
distancing.
my first, and then social distancing. See,
Yes.
we're social distancing and we have on face coverings, all of us. Thank you so much for joining us today on The Pain of Change. On the 27th of September, my guest will be Dr. Jane Close Conley, who is president of the second largest Cal State University in the California, and she's president of Cal State Long Beach. So we'll see you in 2 weeks. Thank you for coming to The Pain of Change.
All right, ladies. Wonderful. That was a blessing.
Thank you.
So
Thanks, everybody.
informative.
Thanks, our
Gosh,
Facebook
so honored to
family.
meet you,
Thank
Dr.
I hope you
Khadijah.
enjoyed it.
Listening.
Wonderful.
See you in a couple weeks.